Hello everyone, my name is Dr. Park. I'm a medicine resident in Memory Healthcare System in Hollywood. So today I will discuss 30-day readmission after supraventricular tachycardia hospitalization. Supraventricular tachycardia is very common and benign disease entity, but management of it is pretty challenging with frequent healthcare utilization such as office visit, ED visit, and everything. And also, there is no data on risk factors of unplanned readmission after SVT hospitalization. So we decided to conduct a study to see what's the risk factors and what we can do better. We conducted a retrospective analysis of 2018 to 2019 nationwide readmission database. We selected the patient older than 18 and then with a primary diagnosis of SVT using ICD-10-CM diagnosis code. And we then performed a univariate and multivariable hierarchical regression analysis. So during the study period, 18,982 patients were admitted with primary diagnosis of SVT. As you can see on table 1, mean age was 65.4. Female was around 55%, and then also 1.4% of them had a chronic kidney disease. Hypertension, about 40% of prevalence. Atrial fibrillation, about 20%. Diabetes, about 28%. Alcohol abuse, about 5.4%. Nicotine abuse, around 15%. Cannabis abuse, about 2%. And then what we found was that unplanned 30-day readmission rate was as high as 11.3%, and half of them occurred within 10 days after discharge. This was pretty significant, and the most common cause of readmission was recurrent SVT, with about 25%. Female sex was associated with lower risk of readmission, odds being 0.9, p-value less than 0.001. Then we conducted multivariable logistic regression. Heart failure found to increase the risk for readmission, odds being 1.3%, p-value less than 0.0001. CKD, odds 1.2, alcohol abuse, odds 1.2, cannabis abuse, odds ratio 1.2, nicotine abuse also 1.1. So those are all of them were statistically significant. And also we also found that cardiac catheter ablation successfully decreased the readmission with odds being 0.66 and p-value less than 0.001, and higher median house income of patients' zip codes was associated with less risk for readmission after 30 days. With the odds being 0.89, p-value less than 0.001. So the bottom line is that unplanned readmission rate after SVT hospitalization was as high as 11%, and then about a quarter of them was due to repeated SVT. And we found out some risk factors including heart failure, chronic kidney disease, atrial fibrillation, low household income like socio-economic status, and substance abuse like alcohol, cannabis, and nicotine. And we found that cardiac catheterization successfully decreased the risk for readmission. That's about it. Thank you.